When it comes to pain, all too often people suffer for much longer than they should. Maybe they've tried a slew of therapies with no relief, or maybe they just don't want to get surgery. And if you're one of those people and foot pain is your issue, well, my next guest says there is another way. In this sponsored segment, I'm happy to have back Dr. Vincent Staschiak with Mid-Ohio Foot and Ankle Specialist. It's good to have you on with me again.
My pleasure. Thank you.
All right. The last time you were on, and I know we talk a lot about these non-surgical solutions you offer because people don't always want to go that route, right? It is kind of that last effort for so many folks, right?
Yep, definitely.
And so let's talk about the what else today and what else the option or what other options are out there. So first of all, tell me what else you do offer.
So other than orthotripsy for the resolution of heel pain, be it plantar fasciitis or Achilles tendonitis with a one-time non-surgical procedure, I specialize for the last 24 years in regenerative medicine. And regenerative medicine is a way of keeping you off of drugs, out of surgery, on your feet, and get you pain-free. And basically, regenerative medicine can induce the body's natural healing responses so that your joints are resurfaced and basically brought over a period of time back to where they were before you started having all that pain.
Right. And I think what's great about it is in all regenerative medicine, I mean, it essentially is a solution with no side effects, right? I mean, and so many people think I get surgery and then a screw comes loose and then I'm back in the ER and I'm doing all this stuff. So this is something that is a natural solution for people.
It is. And the regenerative medicine options that I offer that are available across the country are actually already found in our body.
Okay.
But they do not know where to go unless they are called there or placed there.
Okay.
So whenever you go and you say, you know what, I need some stem cells in order to rebuild this joint.
Yeah.
I can either do a bone marrow transplantation and then take that bone marrow, work it, and then put it into a spot. And now that tells the body, hey, fix me. Resurface that cartilage, repair that joint, take away my pain, because it's just wear and tear over years is why people have pain. You're wearing away the cartilage, which is the protective tissue on the ends of the bone. You finally get down to a point where there's hardly anything there, and then the pain sets in.
Right.
This is a way of repairing everything without surgery.
Without surgery. And the success rate is immense, too.
It is. I mean, I never get tired of people coming back in 6 weeks, because I tell them, you'll start feeling better in 2 weeks, I'll see you in 6. But it's a 6 to 9 month healing process, because that joint's not going to rebuild itself overnight, or that muscle's not going to repair itself, or the ligament or any soft tissue structure. It's going to take 6 to 9 months for it to repair itself. But you're going to start feeling those effects within about 2 to 3 weeks. So when I see people back in 6 weeks and they're like, I'm 70, 80, 90% better.
And
why did the
like,
doctor tell me I need surgery?
Incredible.
Because we are an insurance-based, surgical-based society. We do not practice or teach regenerative medicine, but it is definitely making its face now over the last 10 years.
And it has been tried and true, and that's the thing about it. It's not something new that people are kind of experimenting with. Like, this is something that really is bringing relief to people who found none for so long.
Definitely. I have patients that have rheumatoid arthritis, where you get the deviation of the digits of the hands and the feet, and they have so much pain, and they've tried everything. They've just done all the conservative treatment that they possibly can. And now their only option is either live with that pain or have surgery. And I'm telling you, you don't. With the stem cell therapy, it's one injection and it lasts for years. It can rebuild all of those joints. Now, your deformities aren't going to go away because they're a biomechanical deformity, but they've been there for the last 40, 50 years since you've been suffering with it. But it's the pain that goes away because we're resurfacing all the cartilage. We're repairing, basically getting rid of all that arthritis.
And do you see a lot of people with arthritis and then plantar fasciitis? Is this able to be used in different kind of ailments of the foot?
Oh, it is. Foot, ankle, knee. I mean, I have a lot of people that, with our group that specializes in regenerative medicine, one or two shots in the knee can rebuild an entire knee instead of having just steroid injections. Same thing with the shoulder. When somebody comes in and says, I can't lift it up to here, 6 weeks they come by and they're waving. They're like, I don't need surgery. No, you don't need surgery.
Yeah. And so what do you say? Because I'm thinking majority of the patients that come to you have tried something else, right, doctor? I mean, everybody at some point tries the conservative, tries the physical therapy, tries the steroid shots, and they come to you and they say, you know, I don't think you can fix me. I don't think there is anything, right? Because you get a lot of that, I'm sure.
Yeah, I have my non-believers that come in And they're like, you know what, I'll try this foot over here, and I don't want to do both at the same time. And inevitably, they'll come back in 6 weeks going, all right, you were right, I was wrong, do the other
Right.
foot.
Why can I only walk on my left foot now? I need the
Right.
right one to match. All right, so should somebody reach out, have a consult? Is that kind of the way to get things started? Talk about these options with you?
Yeah, you come in, we get x-rays, I want to work everything up, I want to see what you've had done in the past, what you've gone through, because a lot of the conservative therapy, especially like steroid injections, I mean, it's a temporary internal Band-Aid, it makes you feel better for a little bit, but it's actually destroying the soft tissue structures because it's thinning out the cartilage, it's just hastening the arrival of arthritis. So stop doing the internal Band-Aids is what I tell people. And if you just want to have it fixed, this is your best shot. This is your best shot of being able to stay out of surgery, on your feet, go back to enjoying time with your kids, your grandkids, going on walks, doing what you want to do, and not worry about, we have enough to worry about in this world. We don't need to worry about our foot pain.
Oh, man, and they're important.
Pain or shoulder or wherever.
Right, yeah, exactly. All right, so Mid-Ohio Foot&Ankle.com up there, as well as the phone number. Get in contact with Dr. Staschiak. Thank you so much for being here.
You're welcome. Thank you.